Pleasure to connect with you, and also to know that some great work that you've been doing in India, representing India for the company 3SHAPES, which is actually in the 3D intraoral scanning solutions. And I'm sure the way you've been able to position this company offering solutions in the dental space is enormous, because I think it's great value for dentists to benefit, because this is the age of digital and things are more convenient. It's easy rather going through the conventional manual impressions. This is making things more easier. But I would like to develop on and want to get your inputs in terms of how what are the challenges been before the challenges and the opportunities. And let me ask you where it all started, Ashish, and you've been in the epitome in terms of offering these solutions from the first beginning as a key initiator in India as a representative. Can you please elaborate on that, please? Thank you.
First of all, thank you so much, Dr. John. I mean, we have known each other for so long, and it's a pleasure to reconnect, although virtually, but at the end of the day, I'm very happy to connect with you. Thanks for this opportunity. Looking at how we started, I mean, the operations for India, we started in 2016, late 2016, but it all picked up only in early 2017. So we started with our intraoral scanning technology, which we call TRIOS. And in the first year, we were able to seed in around 75 scanners in the first year. And of course, these were seeded to the who's and who, which we call the initiators, or which we call the innovators. And then we took upon the next level of digitization with their help, in which we educated the market with the help of the innovators. And we participated in a lot of conferences. We participated in implant conference, because our intraoral scanners, they feed into softwares like implant software, orthodontic software for clear aligners, which end up into a CNC or a 3D printing. And 3D printing is the way forward actually for the intraoral segment, because the material science is increasing. So it was not only that the intraoral scanners developed on its own the market, but it was aided also with the developments of 3D printing, material sciences. And since 2017 till today, we have seeded close to around 300 intraoral scanners. Of course, we would have liked to probably have more installations, but then of course this is a COVID year, and we have also faced certain challenges in this particular year. But so far so good. The future, of course, is looking extremely positive. And I think I will touch upon that as we go along in this interview.
Okay, and we as an organization, we also had got the opportunity to recognize your good work as a technology, because 3D GRAPHY Medical Awards, Ashish, is also an initiative that we started for as a platform, as a conference, ensuring that how 3D as a technology can be imparted through knowledge and intellect coming from various different genre of expertise, made with 3D printer, scanners, materials, software, all of that. And while we were doing that, we also created this platform called 3D GRAPHY Medical Awards. And let me, I had to start it from the beginning, but then let me congratulate you for being the 3D GRAPHY Medical Award recipient for the 3D Intraoral Scanner Company of the Year, Ashish. And I'm sure the technology that you are offering is very phenomenally very upgraded. It is really good and it is very convenient. But yeah, with technology there is also price. The price is also going to be there, and that's been a challenge in Indian markets. What do you think for the kind of unique solutions that you're offering? How do you cope with the competition when it comes to pricing? Because that's always been a challenge, and I mean, compromising on quality means then is an issue. So how do you take that as a challenge? Because I thought we'll talk about the challenge before, and then we talk about the opportunities.
Sure. So thank you so much for this award, Dr. John. I mean, we are honored. So, I mean, it's always nice to be recognized, and so thank you so much. Um, Coming to the challenges, as you rightly said, pricing is the key to the Indian market, and technology obviously comes with a price. And 3SHAPE intraoral scanners are not, of course, I must say, the most economical of the scanners for the large part of the market. And this is a challenge. This is a challenge, and the way we are trying to address this challenge is to work with partners in India who can offer some kind of a leasing into the market. So we're offering a 24 a months leasing. We are offering a 3 years leasing. So what this does is, this is a concept of pay as you go. So you're not taking a hefty loan, or you're not taking away your savings initially, and as you make your money, you're paying kind of an EMI to some of our partners who are basically laboratories or service providers. So, and then we have partners who are also into implantology, who are bundling our scanners with implantology products. So this is one of the ways. So as I said, extended payment terms. Our technology also is something which we are trying to subsidize for the market without compromising the quality. So if you look at Trios 3, which is our standard model which we are selling in India, that is also the model which is sold everywhere, whether it's United States or whether it's Europe. So we are not selling any inferior technology or a technology which is below par. But of course, we are trying to offer some kind of incentives, some kind of payment options to our users so that it becomes easier for them to afford this technology.
So you try to create an opportunity around the challenge, maybe eventually. But when it comes to the technology, how do you rate yourself? I mean, we've been already getting some good response, and that's the key reason for having accorded
Yeah.
your honor,
Thank you.
because it's a customer responsive awards actually, Ashish, and we've been getting
Yeah.
these inputs from various customers also in terms of quality, not to compromise, and the way you've been as a company in terms of offering solutions. So that being one, that being said, now that you mentioned that there is also an option with leasing, is there a way that there can be a consortium which can be built around, and where uh, your company can see, how this consortium can operate with penetration, because that's the key. With penetration and with more number of products getting wider uh, expansion and penetration in terms of selling these products. I mean, we're getting go-to-market kind of a thing. In terms of getting that kind of a penetration, I think cost can considerably come down because it's economies of scale at the end of the day. And then probably, so do you think that kind of a strategy is also looked at in terms of giving the right solution? I mean, solution is good. Are we looking at that kind of a, kind of an explosion in the market?
Absolutely. India cannot be approached by a single model, because it's a complex country, it's a big country with diverse kind of customers. So we are also looking for other models. And the model which you have suggested, the consortium model, is something which we may also be willing to look into, if it offers value to our customers, and if it's kind of beneficial to the entire value chain. At the end of the day, as you rightly said, we have to make it affordable, and we have to have economies of scale for any company to be successful in India. So yes, we are open to any we are open to consider these kind of models as well for India. Yeah. I can't hear you.
I'm so sorry. Yeah, I'm
Yeah.
saying, what is your future landmark mark in terms of numbers? Rather than going by numbers, what is the specialization that you would probably want to offer, covering a very wide dentist, because dentistry has different specialization. So, which are the specialization that you would want to focus, and how do you see the market going in the next 5 years?
Yeah. So now, looking at a typical intraoral scanner, we need to understand what is an intraoral scanner replacing. It is replacing a rubber-based impression. And impression is something which every dentist takes in his clinic, irrespective of his profession. It is only when you look at the applications of intraoral scanner, that you look into specialty like implantology and orthodontics. But I think now the time has come where intraoral scanner has to become a gold standard, especially in the COVID era, where if you take a typical tray impression, in the current scenario, there are chances of COVID being latched on to that particular impression. And of course, you're doing cold sterilization, which we know is not a very effective way of sterilization. If you look at our intraoral scanners, they have tips which can be removed, the scanning tips which can be removed and autoclaved. So now the time has come where we believe that scanning technology should be for each and every dentist who can afford. And I always give this example: how much does an quality intraoral scanner cost? It costs it's equivalent to a family of dentists going 2 times to United States in 5 years. So if you can afford to go to United States with a family of 4, 2 times in 5 years, you have bought the intraoral scanner. If you can afford a SUV today, which every dentist aspires to do after a minimum threshold of practice, he tends to go for a higher car. Instead of the car, you can invest in an intraoral scanning technology. So the point is not affordability. The point right now is priorities. From dentist point of view, 300 dentists in India have prioritized to buy the intraoral scanner before they bought probably their BMWs and the Mercs. And I believe this is how the market will go from the dental side, aided by the 3D printing industry, which is coming out with very, very exciting opportunities in, if you look at complete dentures. So today you can probably give a complete denture with an intraoral protocol and a 3D printing protocol in a matter of 5 days, and 2 visits. So it's beneficial for the entire value chain. So I believe, coming back to your original question, I wouldn't like to say that I want to concentrate on a particular specialty. Intraoral scanner is now a commodity for all the dentists, irrespective of what is their specialty.
Yeah. How is the technology gaining more infused responses with AI that you already have implemented, is what I get to know. How does it really help in terms of with data analytics?
Yeah. So there are 2 kinds of artificial intelligence which we are using in our intraoral scanner. One is at the scanning level. When we scan inside the mouth, we need to get the scanned image of the tooth and the gums, the soft tissue. But sometimes you have a tongue which also gets captured. So our software is very intuitive. It has artificial intelligence. It can identify what is tooth, what is gum, and what is non-tooth, what is non-gum, and it just erases that particular anatomy. So that's one of the aspects. The second aspect is when we do intraoral scanning, we also capture the time taken by the operator to scan. We also have other kind of softwares. We have something called patient monitoring. The patient monitoring software which we have in our triage scanner, it's like a timeline. So if you just imagine that if I had gone to a dentist, say in February, and got my mouth scanned, if I go back in August and scan again, both my scans will be superimposed, and the software can intuitively tell me if there's any deterioration or if there is any kind of advancements of caries. So we are using a lot of intuitive software. We are using digital shade measurement, which is again artificial intelligence. So the moment we capture the tooth, we place the cursor on the tooth, it gives us the accurate shade, and we are using a Vita shade guide inside. So it's quite accurate. So these are all examples of artificial intelligence which we are offering packaged with our intraoral scanner, the Trios. And that's.
And Ashish, is there some initiatives that you're driving for the educational, as in the dental colleges and institutes? Because I think they are the ones who will need to actually get handy with this product, because as they, but yeah, there's nothing much scientific in terms of for them to operate, because it's very operational friendly. But
Right.
Is there a training process that you see that is also being initiated by your company?
Absolutely, you hit it correct. I mean, if we have to be successful in India, we need to start with dental colleges, because we need to catch our dentists young. That's the premise. And around 2.5 years ago, we invested in our scanner at the Indian Dental Association headquarter in Prabhadevi, where we have our scanners and all the software. So apart from the scanner, we also have the implant software where you can do reverse implant planning and you can design your surgical guides. We have a software through which you can design your clear aligners, which are basically 3D printed kind of application. Then, of course, we have our software in which you can do your crown inlay, onlay, bridge. So this entire scanner with the software is seeded in IDA, where we plan to do a lot of education courses. We have also seeded our scanners in some of the important institutes in dental colleges, and that's the way forward. And we also have an initiative where we offer our intraoral scanners at relatively discounted rates to private educational centers. So if there's a consortium or if there is a group of dentists who are offering continuing education in the digital space, then we offer our scanners at a particular discount so that they can further education. And education is the key. Without education, we cannot achieve our objectives, Dr. John.
Very true. That's a good initiative, Dr. Ashish, that you've taken. So once again, thank you so much for your time, Doctor, for from the busy schedule that you are actually in. You've been traveling, and wishing you all the best, Doctor. And once again, congratulating you for being the awardee for this particular platform that we've been able to formulate. And we will keep in touch. Thank you so much for your insight, and have a wonderful day. Thank you so much.
Thank you so much, Dr. John. Thanks a lot.